Okay, so last time we were discussing the first aid, we were up to the pharmacology section, which is actually the 21st video for the neuro section because it's such a big chapter, right? They talk about the eye and the ear and all the different pathologies and the actual anatomy of the brain. It just takes up forever. The pharmacology section isn't small either. So they talk about epilepsy drugs first. You're going to see all the different anti-epileptics, which are a struggle. If you're new to it, it's a lot of stuff to learn in a very short period of time. But it's not as hard as it might look. Okay. Then it goes on to discuss medications for the various neurodegenerative diseases, right? So you're going to see Parkinson, Alzheimer's, stuff like that. And one of the reasons it gets even longer to do neuropharmacology is because then they teach you in the pharmacology section about anesthetics, right? So I put in a lot of effort and gathered a bunch of information from various resources, UWorld, AMBOSS, etc., to make this easier to master and learn, because you do need to know how anesthesia works, right? And the various terminology of anesthetic medications. And then they teach you all the different anesthetics too, right? So there's a bunch of stuff. I also have a bunch of practice questions and images and notes from all kinds of areas. So the neuropharmacology videos are probably going to be another like 3 videos, if anything, to wrap up neurology. Literally the biggest chapter in first aid. Pretty much on par with cardiovascular. So let's get started with the epilepsy drugs. You have a bunch of medications here: benzodiazepines, carbamazepine, ethosuximide, gabapentin, lamotrigine, levetiracetam, phenobarbital, phenytoin, topiramate, valproic acid, and vigabatrin. Now, for each medication, you need to know what kind of seizure you could use it for: partial, tonic, absence, or status epilepticus. You need to know the mechanism through which that epilepsy drug works. So when you look at all the different mechanisms, you'll start getting an understanding of what is the right way to help somebody with epilepsy, right? You need to not just know the mechanism for each medication, but the general aspect of, how do you help someone with um, epilepsy of different types. You obviously have to know side effects as it is for any medication. So that's another struggle in itself. And then I have a bunch of various, different ways of memorizing these medications. Even with the memorization tool still, you do have to revisit these medications. And as always, when medication lists like this are presented, it's best to break them up into groups of 2 or 3 and spend entire days just talking about that medication throughout the day, right? So maybe today you might be studying endocrine or something. Spend the whole day talking about like carbamazepine and gabapentin, making sure you could talk about the 2 medications without hesitation, without opening the book. Memorize it by heart, right? And then the next day you might be doing more endocrine or GIT or something. Pick another 2 medications and master them, something like that. It's not as bad though. It's not as bad, especially when you start doing practice questions. So I have 2 general notes first that I'm going to read. So up here I wrote, for partial seizures, right, which are the same as focal seizures, phenytoin and carbamazepine are the first line, and you can use phenobarbital in neonates, which you always remember as give the neonate its Barbie. Lamotrigine is effective against partial and generalized seizures with fewer side effects than phenytoin and carbamazepine. So lamotrigine looks like a great medication. Valproate is for tonic-clonic grand mal seizures, but can also be used for partial complex as well as absence seizures. Benzos are not for regular treatment of epilepsy, but are used for emergency situations like status epilepticus. Levetiracetam is commonly used in neurology because it is effective against both partial and tonic-clonic seizures, plus it has a low side effect profile. So lamotrigine looked great and levetiracetam looks great, right? Over here is another note from UWorld. This one also does a similar breakdown of how to master these medications. So for focal seizures, simple or complex, use narrow spectrum carbamazepine, which is also used for trigeminal neuralgia, or you could use gabapentin, which is also helpful for peripheral neuropathy and postherpetic neuralgia, or you could use phenobarbital for neonates, and phenytoin, which just has many side effects. For generalized seizures, which encompasses all 3 of these scenarios, mainly tonic-clonic and absence, ethosuximide is the best for absence seizures. If tonic-clonic or myoclonic seizures are involved with the absence seizure, then you could use lamotrigine. It helps with all of them, right? So I always thought of the tri as like try for three, like a triangle. So lamotrigine helps with all three issues: tonic-clonic, myoclonic, and absence. For tonic-clonic and myoclonic seizures alone, without the absence aspect, broad-spectrum lamotrigine, levetiracetam, topiramate, and valproate are best. But levetiracetam and lamotrigine look like to be the best medications in the sense that they don't have really bad side effects. So before we move on, I actually want to go back and take a look at the epilepsy section that they had here. So let's see. Where do they talk about seizures? Right here. So when we did this, we saw, right, seizures, they could be broken down into partial or generalized. The partial ones affect a single area of the brain, and you have a nice visual down here too, right? So you can see the partial has a single area of the brain, most commonly originates in the medial temporal lobe, and it can either be simple or complex, where complex basically means you lost consciousness, right? Generalized ones are diffuse, so they go all different parts of the brain, even the deeper parts. They can be absence seizures, where you just have no postictal confusion. Always got to remember that. So basically, after the epilepsy, after the episode of the absence seizure, they'll know it happened, so they're not confused. Myoclonic, tonic-clonic, tonic or atonic, which is just a drop seizure, often confused to be just fainting, right? But it's not fainting, it was actually a atonic drop seizure. So that's the general breakdown. Epilepsy is a disorder of recurrent unprovoked seizures. Febrile seizures are not epilepsy. Okay, febrile seizures are very common in children, in very young children. Status epilepticus is when you have continuous or recurring seizures that may result in brain injury, right? So continuous meaning more than 5 minutes. And then the most common causes of seizures by age. So children, it can be genetic, it can be a febrile seizure due to infection, or it could be due to trauma, right? Adults, usually because of a tumor or trauma, and elderly people, it's usually a stroke. Okay, so that's what we need to keep in mind while we approach patients who might be coming up to us because they have been getting seizures. So now we can start looking at the medications. I have color-coded a couple things here. The blue highlight is for Stevens-Johnson syndrome. Any one of them that can cause Stevens-Johnson has a blue highlight there. The green highlight is for any labs that need to be monitored. Oftentimes you get questions where it might even tell you like, oh, this patient was put on carbamazepine. What should you monitor, right? What lab should you watch? And then the orange highlight is for anything that's teratogenic, like carbamazepine right here. Okay, so that's the general stuff right there. Excuse me. So that's the general color coding I've done. Some of these, you might have heard of a black box warning. A black box warning is the strictest warning put in the labeling of prescription drugs or drug products by the FDA, the Food and Drug Administration in America, when there is reasonable evidence of an association of a serious hazard with the drug. So that's what it means if you ever see a black box warning on anything. So now how do we memorize all these medications? First things first, I want to look at status epilepticus, right? So status epilepticus, let's look at where all the check marks are for that. So there's benzodiazepines. Benzodiazepines, as you can tell, are unique. You can't use it for any seizures in general. It's not really for seizures, but it does help with status epilepticus. You can use phenobarbital or phenytoin, the two guys that have a pH in them, and then that's it. All right. There's a code here for the asterisk that you're seeing. 1 asterisk is common use. 2 asterisk is the first line for acute, and 3 is the first line for recurrent or chronic, right? So basically what we're getting here is first line for acute status epilepticus is a benzodiazepine. First line for chronic status epilepticus is phenytoin. So if you have both answer choices there in a question presenting about status epilepticus, you have to figure out, is it acute or is it something that occurs recurrently on this patient? And based off of that, you would pick either phenytoin or benzodiazepine. Phenobarbital is the third one here. It is the first line in neonates. So if it's a really young neonate with recurrent status epilepticus, then maybe phenobarbital would be the answer there. Alright, and then from there we can just start looking at it now. So benzodiazepines, what do benzodiazepines do? These are a pretty high yield medication. They've been talked about forever, even in med school. They hyperpolarize your mind to relax your mind. So how does it work? It increases GABA A action. Okay, and there is a difference between GABA A and GABA B. I have not actually denoted it here, so I'm not going to talk about it, but I'll write it over here and talk about it in my next video. But here, for benzodiazepines, you have to remember that it's a GABA A upregulation, right? More GABA A action. Increases the frequency of chloride channel opening by GABA. You remember, this is the difference between benzodiazepines and barbiturates, right? Barbiturates were the one that were increasing the duration of chloride channel opening, whereas here benzo, the Z is supposed to remind you of speed, right? Like zooming through something, so it increases the frequency of chloride channel opening by GABA A. Side effects are just the more significant one are sedation and dependence, right? The dangerous one is respiratory depression, so you can't really give it to someone who might have COPD or something like that. The other note they put here is that benzodiazepines are also used for eclampsia seizures, right? So first line is magnesium sulfate, but you can also use this for eclampsia seizures as well. And that's all you need to know for benzodiazepines. The first true medication we have here is carbamazepine. Carbamazepine is used for partial focal seizures or for tonic-clonic. And the 1 star, remember the 1 star means common use. So for someone presenting with partial focal seizures, it is a common use to give them carbamazepine. How does carbamazepine work? It blocks sodium channels. So far basically we're learning, remember that I said the mechanisms are not things you just learn from the medication but also for general knowledge. We're learning that blocking sodium channels actually helps, right, with seizures. So when you get questions about mechanisms, if you see an answer choice that says opening sodium channels, it would be very wrong to pick that, right? It wouldn't make any sense. So that's actually an answer choice that you can knock off the list, right? That's kind of what I'm trying to get at by telling you that these mechanisms are actually teaching you how you help somebody with seizures, okay? So carbamazepine blocks sodium channels. It has many side effects. It actually has all 3 color codes here, right? So it can do agranulocytosis or aplastic anemia. It can cause liver toxicity, right? So you would be watching CBCs and LFTs, right? Liver function tests or liver enzymes. It is teratogenic. It can cause cleft palate and spina bifida. And it can also cause SIADH, another thing really nice and important to watch out for, right? Syndrome of inappropriate antidiuretic hormone. So there might be issues with the osmolality in the urine. It is an inducer of P450, so it upregulates the metabolism of many medications, and it can cause Stevens-Johnson syndrome. Okay, so carbamazepine prevents depolarization to stop tonic-clonic activity. It prevents the depolarization by blocking sodium channels. I have this memorization tool here. I wrote, it's bad for blood just like carbs, right? Carbamazepine is bad for blood just like carbohydrates. Too many carbohydrates is just going to lead to diabetes and stuff. So that's kind of something I made up. The middle note here I'll come back to later, but yeah, definitely want to make sure you remember that anyone on carbamazepine, if they have aplastic anemia, if they have elevated liver enzymes, if they're thinking of getting pregnant, or if they're taking other medications affected by P450, or if there's an issue with their osmolality of the urine and stuff like that, all of that is significant. Okay, so very important to watch out for that. Carbamazepine, as we saw earlier, is also the first line for trigeminal neuralgia. Okay, where you might have a person who has like a very shocking sensation along their jaw when they're shaving or brushing their teeth or something like that. Okay. Next medication is ethosuximide. This is a very easy medication. It is literally just common use for absence seizures. Okay, so there's a note right here. It sucks to have silent seizures. One way to memorize what it does. This was actually an image I found online for ethosuximide. So it helps you memorize pretty much everything you need to know. I'll come back to it. Let's actually read what's here first. So here they wrote, it blocks the thalamic T-type calcium channels. So now we've seen 3 different ways to help people with epilepsy issues, right? You can either increase GABA A action, which is really just for status epilepticus. You can block sodium channels, or you can block the thalamic calcium channels. Both of them are ways to kind of help with different kinds of seizures. This thing has many side effects too. It can cause GI distress, and it can cause this weird itching and urticaria that might throw you off in a question. And it can also cause Stevens-Johnson syndrome. So if you get a patient who if you get a question where they tell you stuff that doesn't seem to be matching with each other or doesn't seem related to each other, it probably is. So if a patient comes in and they tell you, oh, this patient was here last week for absent seizures, you prescribed some medication, now they're coming back to the hospital because they have urticaria for some reason, they have no history of travel, no history of any kind of animals or anything weird like that at all, no real reason for getting urticaria, you have to understand that he was probably given ethosuximide for his absent seizures, and now he's getting a side effect. That's it. Okay, so really important to know how you're going to get questions on this stuff. And this is how this image kind of helps you memorize it. So this is from baronrocks.com. It's not my own work. baronrocks.com. This guy has a bunch of different images to help you memorize all kinds of other stuff. So, definitely worth checking out. And this is what he made up for ethosuximide. So ET, because ET is that alien, ET sucks a mind until all thoughts are absent, right? So you can see this is how you usually abduct humans, but this is actually abducting the brain away from this human, right? So ET is abducting the brain away, so you have no brain, hence the absence seizure. ET also stands for affects the thalamus, right? Because it's thalamic T-type calcium channels. It affects the T-type calcium channels, so that's another thing ET stands for. Right, transient opening, and it affects the tiny petit mal seizures, which are absent seizures. Just basic things to memorize for ethosuximides, right? So now the sucks part was one thing to help you. ET is another way to remember. T-type calcium and thalamus, thalamic T-type calcium, the mechanism. You can memorize that with ET. Okay. Other than that, the urticaria is something you just have to remember on your own. Just keep repeating it to yourself. Hopefully you'll see it in the question and you'll be able to memorize it even better after that. Next medication is gabapentin. Very nicely named because it actually helps you remember the mechanism. So gabapentin is only used for one thing, partial seizures. That's it. Right? And we wrote it up here. For focal seizures, simple or complex, used carbamazepine, gabapentin, or phenobarbital or phenytoin, right? And gabapentin is the one that you can only really use for one type of seizure, and that's partial seizures. This also helps me remember the postherpetic neuralgia, which only affects half of your, is half of your body, right? It's only on one side. So that's also, in a sense, partial. It's focal to half of your face or whatever. And peripheral neuropathy. Peripheral neuropathy is usually a thing that is bothering people with diabetes or something. You can give them gabapentin so they don't get that weird tingling sensation they're getting in their arms and legs. So how does it work? This primarily inhibits, again, calcium channels, right? It inhibits calcium channels. So if you see a question where it's opening calcium channels, the answer choice is opening calcium channels or opening sodium channels, it's probably wrong, right? If you get a question on the mechanism of how some anti-epileptic drug is working, and you see answer choices of opening calcium, opening sodium channels, those are wrong. Opening chloride channels, though, that is okay, because that one actually happens, right, with the benzodiazepine stuff. So gabapentin, this inhibits calcium channels designed as a GABA analog, right? So it's a GABA analog, and it inhibits the calcium stuff. So I renamed it as gabapentin, right, calcium inhibitor. Okay, so C-A and I-N are caps locked over here in capital. So that's kind of how I memorize what gabapentin does. It's also a GABA analog, so it does not inhibit GABA though. Right? So don't get that mixed up. It doesn't inhibit GABA. It kind of looks like GABA. It works like GABA. So it's similar to how benzodiazepine was working. Right? And again, similar to benzodiazepines, it can cause sedation, ataxia, but nothing significant as far as side effects are concerned. So gabapentin is cool because it doesn't have major side effects, and it can't really be used for many seizures, but it does help with the partial seizure, which is good enough. All right. Next one, lamotrigine. The two guys with L's are not that bad, but lamotrigine has this one really big issue. It's really, really rare, but it can occur. So lamotrigine is actually the guy that has a black box warning. Okay, so we'll get to that. What do you use lamotrigine for? So remember I said the tri here is like the tri and triangle. It helps with three things. So all three things. It can help with the partial, tonic-clonic, or absent seizures. All three things. How does it work? It works very similar to carbamazepine. It blocks sodium channels, right? And by doing so, it also inhibits the release of glutamate. The only major side effect it has is the Stevens-Johnson syndrome, but the more dangerous thing it can cause is the hemophagocytic lymphohistiocytosis. Right, hemophagocytic lymphohistiocytosis. This is actually taught in first aid now. It wasn't taught before, but now it is. Hemophagocytic lymphohistiocytosis is a condition in which the body makes too many activated immune cells, the macrophages and lymphocytes. Okay, so they talk about this in first aid now. I'm going to put what page it was over here also. Let's see what page it is though. I forgot. I think it was at the end of Hem Onc Pat. So right here, see? This is a new thing in 2019. Hemophagocytic lymphohistiocytosis is a systemic overactivation of macrophages and cytotoxic T cells, leading to fever, pancytopenia, hepatosplenomegaly. Pancytopenia being the most notable thing here, can be inherited or secondary to strong immunologic activation, such as after Epstein-Barr virus infection or some malignancy. Bone marrow biopsy shows macrophages phagocytosing marrow elements. Right, so this image is supposed to show you that, but I feel like the image I found online did a better job. Right, so this is a bone marrow biopsy here too, where you're seeing multiple nucleated cells within the cytoplasm of a single hematopoietic progenitor cell. Right, this is very predictive of HLH, hemophagocytic lymphohistiocytosis. All right, page 469. Okay, so there's that. So that was lamotrigine. Pretty nice medication. Both of these things, SJS and hemophagocytics, are pretty rare side effects, so you do have to watch out for it, of course. It's not like it can't happen, but other than that, it doesn't have any other side effects that can occur more commonly. Levetiracetam can help with partial and tonic-clonic, but not with absence, okay? So where this plays a special role, lamotrigine, is that if you get a patient who comes in on a question, right? You got a patient who has absence seizures, but has also had tonic-clonic seizures in the past, maybe even has had focal seizures in the past, you can give that patient lamotrigine, right? Just monitor them for SGS and hemophagocytic lymphohistiocytosis. Levetiracetam, though, this one, it says mechanism unknown, which really helps us. So since it's unknown, you don't need to care about the rest of this shit here, all right? They wrote may modulate GABA and glutamate release, inhibit calcium channels. Doesn't know though, it's unknown. So just leave it at that. Symptoms this can cause, neuropsychiatric symptoms like personality change or drowsiness. But again, nothing common. This is not that common for someone on levetiracetam to have a personality change. So just, as far as we're concerned, it really doesn't do anything. That's why lamotrigine and levetiracetam are pretty nice medications. Phenobarbital, always remember, you have to give, you can either remember phenobabital or remember to give the baby its Barbie doll, right? Either one of those things. It's the first line in neonates. It's used for the partial seizures, tonic-clonic, and it helps with status epilepticus. This one also elevates GABA A action, just like benzodiazepines, right? If it helps with status epilepticus, it probably does something like that, right? So phenobarbital and benzodiazepines both increase GABA A action. Barbiturates, like phenobarbital, increase the duration of chloride channel opening by GABA, which is why you have this increased GABA A action. They're both very similar. They're similar classes of medication. So since they're similar classes, they have similar side effects: sedation, and tolerance, and dependence, and cardiorespiratory depression. So you can't give this to someone who might have a history of cardiac disease, COPD, maybe even someone who's like using heroin. You can't give it to them either. And it's also an inducer of P450. I didn't highlight the inducer of P450 stuff because you have to learn the P450 medication on a separate basis on your own. Not here, but P450 stuff is also significant, right? So far we saw that carbamazepine upregulates P450. Phenobarbital also upregulates P450. This next medication also is an inducer of P450, phenytoin. Phenytoin is commonly used for tonic-clonic seizures, and it's the first line for chronic status epilepticus. This thing blocks sodium channels, and in pharmacology, with the pharmacokinetics and stuff, we learned that it has zero-order kinetics. It was the P in PEA, right? Phenytoin, ethanol, and aspirin, I think was the A. Yeah. Zero-order kinetics. So phenytoin has a whole list of side effects. that often get tested, very high yield side effects. P450 induction, so all your other medications are being metabolized quicker. Hirsutism, right, so hair growth in random places. Enlarged gums like this, okay. Nystagmus, yellow-brown skin, teratogenicity, because it can cause fetal head and toe syndrome. Osteopenia, inhibited folate absorption, which is why it's the inhibited folate absorption is actually why it's teratogenic. And neuropathy. The rare syndromes it has are DRESS syndrome, lupus-like syndrome, just like the hydralazine from cardiovascular, and toxicity leads to diplopia, ataxia, and sedation. And the reason they have this here is because someone could try committing suicide by just taking a lot of phenytoin, right? So you would see the diplopia in them, and they would probably be knocked out. Reduces levels of digoxin and vitamin K, so you have to give vitamin K supplements. Also interferes with folate metabolism, so you have to give folate to prevent the megaloblastic anemia. And lastly, it interferes with the activation of vitamin D, so you may note osteomalacia or the osteopenia they put here. Right, so there's a lot of nutrients involved with phenytoin. And that's generally it for that. Nothing too crazy. Topiramate is my favorite medication in this list, and if you've watched my older videos, I've probably talked about it a lot of times in the past. This is a really cool medication that you can take for focal seizures as well as tonic-clonic. And the cool thing about it is that it causes weight loss, but no one really knows how. It actually just causes weight loss. When I was doing my internal medicine rotation, which is a 12-week rotation, there was one younger girl. She had absence seizures as well as tonic-clonic seizures, and she was taking topiramate because she was on valproate before. She didn't like it so much, so she started taking topiramate after that. Her absence seizures were being helped a little bit, but not so much. As you could tell, it's not actually for absence seizures, right? But it did help her either way. And she was pretty heavy when she came in, and I think this was still in like my first 2 weeks. By the end of my rotation, she was very, very skinny. She had no diet changes, no exercise changes, no lifestyle changes, nothing like that. Right? So it is a really, really big deal. It's pretty much like a magical weight loss pill. Online, there are many forums where people talk about it, weight loss because of topiramate. Right? Everyone that takes topiramate loses weight. It's a very interesting medication. The only weird thing about it is you also end up kind of having this mental dulling. So in 2019, they did this new thing. They highlighted a bunch of S's and made everything by S. In 2018 and before, they used to call it mental dulling, a bunch of other stuff. So you can see it causes sedation, slow cognition, right? Sight is threatened because it can cause glaucoma. You can also get kidney stones. You can have speech difficulties, right? You can't remember the word you wanted to say. So I often call that a word fart, right? You just forgot the word you were going to say. Like you have it at the tip of your tongue. You know what you want to say, but you can't remember the word. Right? So those are some silly things that can happen at a price. You also lose your weight though. So it's a pretty interesting thing. I feel like research needs to be done to figure out how it's causing weight loss, and maybe you can devise a medication that only does that and not the, blocking sodium channels in the brain part. And it does increase GABA action. But you cannot use this for status epilepticus. It doesn't help there. Topiramate was also given to that same patient of mine because she had migraine issues, regular migraine issues. So it was a good medication for her to have. She would be taken care of for her migraines as well as being taken care of for her tonic-clonic seizures. Before that, though, she was on valproate. So through this rotation, I got to learn the difficulties people have. Valproate actually makes you gain weight. You see? So another reason she also lost weight was because she stopped taking the valproate, and on top of that, she started taking topiramate, so she had double the reason to lose weight. Valproic acid increases sodium channel inactivation, right? So it basically blocks sodium channels, just like carbamazepine. And it increases the GABA concentration by inhibiting this enzyme GABA transaminase. So GABA transaminase is inhibited. You have more GABA availability. Valproate can cause GI distress, some hepatotoxicity, so you have to measure LFTs. It can cause pancreatitis. It is teratogenic, right? It can cause neural tube defects and contraindicated in pregnancy because of that. Also used for myoclonic seizures, bipolar disorder, and migraine prophylaxis, again, which is another reason valproate was good for her. Right? Valproate was actually used for focal absence seizures as well. So because I created a patient in my mind who I actually worked with, right? Like I served that patient. Memorizing these two medications became cake. Like I literally understood it perfectly because of her, and she was also on birth control because she shouldn't be getting pregnant, right? She's taking valproate, she better not get pregnant. So, it's nice. Another mechanism I often tell people when they're asking me how to memorize pharmacology is to make up characters, pick a person in your life that you might know. They might not actually have these diseases and they might not actually need these medications, but you can act like they're your patient. You prescribe them these medications and you explain them how to take it, what to watch out for, and you monitor them in your head. Right, that's kind of what doctors really do. They have actual patients they're giving medications to, and they have to monitor how their labs are looking. That's why doctors always remember how medications work, what their side effects are, what contraindications there are to other medications, right? Because they're actively working with these things. If you're just sitting there and reading it, though, it becomes a lot harder to memorize. The last medication on this page is vigabatrin. Right, so in this medication, you can see again the GABA, the IN at the end, and Vi. Remember, nothing is inhibiting GABA, though. We're not saying GABA is being inhibited. Same thing here. Gabapentin does not inhibit GABA. You don't want to inhibit GABA. You want more GABA-A action. But what does it do? So vigabatrin is used for, again, only focal seizures, just like gabapentin, only focal seizures. Vigabatrin increases GABA. It irreversibly inhibits GABA transaminase, just like valproic acid. Okay, so you would have more GABA available. One black box warning this medication has is permanent visual loss. So that's pretty bad. That's really, disturbing. So I broke it down into like this. Vision GABA transaminase inhibitor. That's what vigabatrin means to me. That's how I broke it down. Right? So you always remember that. And you have to remember these medications in this like visual way also. So you can remember that valproate also stops GABA transaminase. And that's really it. That's it. That's all your medications here. It takes some time. You have a bunch of memorization tools. You have to look at it a couple times, print the page out if you can, and just work with it and act like you have patients you're giving it to, because that's kind of what you're going towards. Act like who you're going to be. And it could really help you memorize the medications, because it did to me. I actually was, rotations are a form of acting as a doctor. And I actually was working with these medications in my internal medicine rotations. I didn't do a neurology rotation. I'm sure if I did, that would have helped me a lot more too. But I was good to go just from the internal medicine experience I had. At the bottom here, I have one question. So this is from UWorld. It says, a 25-year-old woman with newly diagnosed seizures comes to the emergency department with fever and skin rash. She had her first seizure 6 weeks ago, and an MRI of the brain revealed no structural lesions, so she doesn't have a tumor. She was started on phenytoin 4 weeks ago. So let's see if that makes sense, right? Phenytoin. So phenytoin is for all three of these things, right? But it doesn't. It's not going to help. It's not for all three. Sorry, status epilepticus doesn't really count. It only helps with tonic and focal seizures, but it doesn't help with absent seizures, and that's okay because she's not really having absent seizures per se. So she was started on phenytoin 4 weeks ago, and now she's presenting with this skin rash. As anytime you ever see something like this, they tell you it's phenytoin, but anytime you see someone who started an anti-epileptic and now has a skin rash, you should think of phenytoin, because phenytoin has many side effects, probably the most on this page. Right? Carbamazepine and phenytoin have the most side effects on this page, and it's really important to make sure you're remembering those two medications when you see it. So they go on to tell you her temperature is pretty high, 102 F. There's a diffuse confluent erythema involving 60% of the body, palpable generalized lymphadenopathy, and symmetrical facial swelling. What lab finding is most likely to be present? So then the explanation says the patient's cutaneous and systemic findings suggest DRESS syndrome, drug reaction with eosinophilia and systemic symptoms. Hence, we would find eosinophilia. Alright, and that was an answer choice. So when you see eosinophilia as an answer choice, you should think of DRESS syndrome and evaluate whether DRESS syndrome is a possibility. Commonly associated drugs include anticonvulsants, allopurinol, sulfonamides, and some antibiotics like minocycline and vancomycin. The mechanism is unknown, but most likely involves drug-induced herpes virus reactivation, followed by clonal expansion of T cells that cross-react with the drug. So the herpes virus reactivation is why she has that high temperature as well. Withdrawal of the drug fixes everything. That's it. Okay, so really important to understand what DRESS syndrome looks like, what SJS looks like, because they can describe those things to you. We've talked a lot about lupus-like syndrome when we were doing cardiovascular, and we talked about procainamide and hydralazine. Those were the other two medications that have lupus-like syndrome. And that's about it. So spend some good time here, memorize it. You really shouldn't need to revisit this too many times, but it is a good page, and this is a nice way to organize all the medications by first aid. In the next video, I'll continue on and go into more of these and talk about the rest of the stuff here, and then I'll do a third video to talk about anesthetics. Alright, thank you very much for joining, and I'll see you guys later.